Vitamin B12, also known as cobalamin, is a crucial nutrient for our overall health. It plays a significant role in maintaining nerve function, the production of red blood cells, and DNA synthesis. Despite being so essential, vitamin B12 deficiency is more common than you might think, especially among vegetarians, vegans, and the elderly. The body does not produce this vitamin naturally, so we must get it from animal-based foods or supplements. Left untreated, a deficiency in this vitamin can lead to serious health issues. Here, we will discuss 8 symptoms of vitamin B12 deficiency that should never be ignored. Number 1. Fatigue and weakness. One of the earliest and most common symptoms of vitamin B12 deficiency is constant fatigue and weakness. This occurs because B12 is essential for red blood cell production, which transports oxygen throughout the body. Without enough B12, the production of these cells decreases, leading to reduced oxygen levels in your tissues. This can cause anemia, making you feel tired and weak even after a good night's sleep. If you find yourself consistently low on energy despite no significant changes in your lifestyle, it may be worth considering a B12 deficiency as a potential cause. Number 2. Nerve problems like tingling and numbness. Vitamin B12 plays a crucial role in maintaining the myelin sheath that protects nerves. When B12 levels are low, this protective sheath can deteriorate, leading to nerve damage. This damage manifests as a tingling sensation in the hands, feet, or extremities, often referred to as pins and needles. Over time, these sensations can turn into numbness or even lead to a loss of balance and coordination, making it difficult to walk or maintain posture. Number 3. Memory loss and cognitive issues. Memory loss, forgetfulness, and difficulty concentrating can be signs of a vitamin B12 deficiency, particularly in older adults. Vitamin B12 is crucial for maintaining the health of neurons and for brain function. A deficiency can lead to cognitive decline, making you feel like you're in a mental fog. Some people even experience confusion or symptoms that resemble dementia. Addressing the deficiency can help improve these cognitive functions, but prolonged deficiency can cause permanent damage. If you or a loved one notice a decline in memory or cognitive abilities, it is important to consider B12 levels in addition to other potential causes. Number 4. Pale or jaundiced skin. Vitamin B12 is crucial for producing healthy red blood cells. A deficiency can lead to a condition called megaloblastic anemia, where red blood cells are larger and more fragile than normal. These weakened cells can break down more easily, releasing a substance called bilirubin that gives your skin a pale or slightly yellow hue, known as jaundice. While pale skin or jaundice can have several causes, vitamin B12 deficiency is one of the conditions that should be ruled out, especially if other symptoms on this list are present. Number 5. Shortness of breath and dizziness. Low levels of vitamin B12 can make you feel short of breath or dizzy, particularly after physical exertion. This symptom is again linked to anemia caused by B12 deficiency. Without enough red blood cells to carry oxygen, your body's organs may not receive the oxygen they need, making you feel out of breath or lightheaded. While occasional shortness of breath can happen to anyone, if you find it occurring regularly or alongside other symptoms like fatigue, it's important to consult a doctor and consider getting your B12 levels checked. Number 6. Mood changes, depression, and anxiety. Vitamin B12 has a direct impact on the production of serotonin, a neurotransmitter that regulates mood. Low levels of B12 can lead to decreased serotonin production, which in turn may result in mood changes, anxiety, or even depression. Studies have shown that individuals with a B12 deficiency are more likely to experience mood disorders, even when other factors are accounted for. While supplements might not replace other treatments for mood disorders, addressing a B12 deficiency could make a significant difference in your mental health, and if you notice a sudden change in your mood, it could be beneficial to have your B12 levels evaluated as part of a holistic approach to your well-being. Number 7. Glossitis and mouth ulcers. Glossitis is a condition where the tongue becomes swollen, inflamed, or appears smooth and red. It can be quite painful and can affect the way you speak or eat. Vitamin B12 deficiency is one of the underlying causes of glossitis and mouth ulcers. This is because B12 plays a vital role in the production and maintenance of red blood cells and tissues, including those in the mouth. A lack of B12 can cause this inflammation, making your tongue feel sore and uncomfortable. In addition, some people with a B12 deficiency might experience other oral issues like a burning sensation in the mouth or a metallic taste. These symptoms can improve with proper B12 supplementation. Number 8. Visual disturbances. In severe cases, a vitamin B12 deficiency can affect the optic nerve, which is responsible for vision. This can result in blurry vision, double vision, or even temporary vision loss. The damage occurs because low B12 levels can affect the nervous system, including the optic nerve, leading to a condition known as optic neuropathy. While this is a less common symptom, it's important to take it seriously as it may become irreversible if not addressed promptly. If you experience changes in your vision along with other symptoms of B12 deficiency, seeking medical attention is crucial to prevent further damage. Who is at risk of vitamin B12 deficiency? Certain groups of people are more at risk of developing a vitamin B12 deficiency, including vegetarians and vegans. Since vitamin B12 is naturally found in animal products, those following plant-based diets may not get enough from their diet alone. Elderly individuals. As we age, our bodies can have a harder time absorbing B12 due to decreased stomach acid production. Individuals with digestive disorders, conditions like celiac disease, Crohn's disease, or those who have had weight loss surgery may have difficulty absorbing B12. People taking certain medications. Some medications, such as proton pump inhibitors or metformin, can interfere with B12 absorption over time. How to treat and prevent vitamin B12 deficiency. The good news is that vitamin B12 deficiency is relatively easy to diagnose and treat. Blood tests can determine your B12 levels, and your healthcare provider may recommend oral supplements, injections, or dietary changes depending on the severity of the deficiency. For those at risk of deficiency, eating a diet rich in B12 can help, including foods like animal liver and kidneys, some of the richest sources of B12. Fish and shellfish. Tuna, salmon, trout, and clams are particularly high in B12. Dairy products and eggs. Milk, cheese, and eggs are good options for those who consume dairy. Fortified foods. Some cereals, plant milks, and nutritional yeast products are fortified with B12, making them a valuable option for vegans and vegetarians. Final thoughts. Vitamin B12 is an essential nutrient that supports many vital functions in the body. Ignoring the symptoms of deficiency can lead to severe health complications, including permanent nerve damage, anemia, and cognitive decline. Being mindful of your diet, especially if you belong to a high-risk group, and paying attention to the symptoms listed above can help you avoid the adverse effects of B12 deficiency. If you suspect you might be deficient, it's important to consult with a healthcare professional who can guide you through testing and treatment options. A little attention to this crucial vitamin can go a long way toward maintaining your overall health and well-being.